Indeed, I'm particularly happy to present the results of the NeoRHEA study, as this was an academic study sponsored by Institut Jules Bordet. It's a phase II single-arm study testing the combination of palbociclib and endocrine therapy for 4 cycles in the neoadjuvant setting for patients with hormone receptor positive, HER2 negative early breast cancer. So we presented the primary analysis of this study. So the primary endpoint of NeoRHEA was the identification of biomarkers of non-response at ultrasound by using baseline mRNA-seq data. So overall, in NeoRHEA, 100 patients were enrolled, and of these, 73 had available mRNA-seq data. And in terms of response to the treatment, we observed a pathological complete response rate of 1%. That is quite low, but is in line with data from literature. We are talking about luminal breast cancer, and these data are consistent with the clinical trials using CDK4/6 inhibitors in the same setting. And conversely, we observed a very high rate of cell cycle complete arrest. More than 70% of patients had a cell cycle complete arrest with a Ki67 of less than 2.7% at surgery. And this shows that CDK4/6 inhibitors are effective in terms of proliferation shutdown. In terms of predictive biomarkers, we observed an interesting finding regarding CDK6, in the sense that patients with higher expression at baseline mRNA expression of CDK6 had a lower rate of response at ultrasound, and also lower rate of cell cycle complete arrest. And then we also performed some gene set enrichment analysis. And here we observed that responders had an enhanced immune activation, higher proliferation, and lower estrogen receptor signaling. So again, these are exploratory findings, requires of course an independent validation, but I think they are important really because they provide an additional step in understanding the heterogeneity in response to CDK4/6 inhibitors.